There's a huge myth that Medicare stops at the border. For millions of Americans, that's simply not true. Knowing the secret to using your US-based health insurance overseas can save you thousands and unlock your dream retirement. Hi there, I'm Bill Hare, and today we're busting the biggest myth in expat healthcare. Welcome back to Affordable Retirement Abroad. The number one question I get is, what about healthcare? People are terrified of giving up their Medicare. They believe they have to buy expensive international insurance or risk paying entirely out of pocket.
But here's the truth that most people don't know. Many Medicare Advantage plans include coverage for emergency and urgent care worldwide, and in some countries, you can even use it for direct billing. By the end of this video, you will understand how this works and what your real options are.
Let's be very clear. The expat Medicare myth is half true. Let's look at the three types of Medicare plans.
Original Medicare is the choice of 10% of American retirees. Another 40% are enrolled in Medigap plans. The remaining 50% have Medicare Advantage. So, how do the three plan types address the needs of expats? Original Medicare, that's Parts A and B, does in fact stop at the border. If you only have Original Medicare, you have virtually no coverage overseas. This is not a viable plan for expats. Many Medigap or supplemental plans, such as Part G and N, offer a foreign travel emergency benefit. However, it is extremely limited and designed for short-term travel, not for living abroad. The coverage typically has a $50,000 lifetime limit and only applies to the first 60 days of a trip. It also requires you to pay a $250 deductible and 20% of the cost thereafter. This, too, is not a sustainable long-term healthcare strategy. But that's not the whole story. Over half of all Medicare-eligible adults are now enrolled in Medicare Advantage plans, also known as Part C. These are plans from private companies like United Healthcare, Humana, Aetna, and Blue Cross. And here's the key. By law, these plans must offer, at a minimum, the same coverage as original Medicare, but they often include extra benefits. One of those common extra benefits is worldwide emergency and urgent care coverage.
So, how does it work? The most common way is the pay-and-reimburse model.
Let's say you're in Portugal and you have one too many glasses of port in Porto, so you fall off this trolley and break your wrist. That's an emergency. You go to a local private hospital, pay for the treatment out of pocket, which is already much cheaper than in the US, and you get an itemized bill. You then submit that bill and the medical report to your Medicare Advantage provider back in the States. They will then reimburse you for the covered expenses just as they would for an out-of-network emergency in the US. This is a game changer. It means you don't necessarily need a separate, expensive international policy for emergencies. Many savvy expats use this strategy. They pay cash for cheap, routine checkups and rely on their Medicare Advantage plan as their safety net for anything sudden or serious. To keep the plan active, they simply maintain a U.S. address with a family member and may return once a year for an annual physical.
But in some places, it gets even better. A new model is emerging.
For example, in popular expat hubs in Mexico like Lake Chapala and Puerto Vallarta, there are now hospital networks that have created a system to directly bill Medicare Advantage plans. A company called Lakeside Medical Group, for example, has agreements with major providers like United Healthcare, Aetna, and Humana. By becoming a member of their group, you can go to one of their network hospitals in Mexico, show your Medicare Advantage card, and they will handle the billing directly. You don't have to pay up front. You don't have to file for reimbursement. This is the future of expat healthcare. In fact, several hospitals in popular expat cities in Panama have recently adopted this very model, offering Medicare direct billing arrangements. This approach combines the affordability of living abroad with the convenience of using the insurance you already have. This is the kind of insider knowledge that makes a move overseas not just possible, but practical.
As you can see, the world of expat healthcare is more complex and more promising than most people think. Navigating the specifics of your own Medicare Advantage plan, finding providers who will work with it, And building a comprehensive strategy is a huge undertaking. That's why we dedicate an entire section of our course, Mastering Affordable Retirement Abroad, to a deep dive on healthcare.
We show you how to analyze your own plan's foreign travel benefits, provide resources for finding doctors, and help you build a healthcare strategy that gives you peace of mind. Don't let the healthcare myth stop you. Get the expert-led comprehensive plan by visiting affordableretirementabroad.com/course. If this video opened your eyes to what's possible, do me a favor and hit that subscribe button. We're here to give you the real, actionable advice you won't find anywhere else.
The key to a successful retirement abroad is knowing the facts, not the myths. We're here to bring you the truth.
If you're ready to learn the core principles of making this overseas retirement dream a reality, check out the recommended video which you can see on the screen now. Thanks for watching.